give you a really quick overview of a patient onboarding process that I built. This was put together in a couple hours and it includes the data layer, the forms, as well as the workflow. And the process actually gets initiated when a record gets created. And once that record's created, we go through the workflow. And the different activities that we have are patient accepted, patient call, and then we've got some outcomes from the patient call that will occur. So within patient accepted, we're actually going to notify the patient that they've been entered into the system. And all of this is built through just drag and drop event wizards. So I can drag and drop a new item into here. And in this case, in notify patient, this is all wizard driven. So if I go through here, you can see that we'll name the event. We'll go ahead and do the from, and the to is actually a data piece that was in our record that was written. So I'll grab the patient's email. I'll send them a welcome to Denalix Health. I'll actually respond with the first name as well as the condition, saying that they're in the system and a nurse will contact within 24 hours. Right, so that's one of the first steps, and all the code gets built for that. Then I run a nurse lookup. Now, the nurse lookup goes, looks at the zip code and finds an appropriate nurse, and then will update the record and then notify the nurse with an email that they have a pending patient. So all of those different events are within the patient accepted activity. Once all that happens, we move on to the patient call. And all the while, we're actually updating the status of the workflow on the record. Now, the nurse phone interview is actually a smart form step. And as we go through the workflow, we'll actually select a form that's assigned for that workflow step. We'll create a state of that form so that we know you can have different states and different workflow steps. We'll actually create a reference, and that reference is information that's grabbed from the form that we can use later on in the workflow to do different activities. We can assign different parameters. These are the rules that were built for the form. Just defines how the form behaves when it's opened. We can actually transfer process data to the form. So if we had during this, what you'll see in the form is that we're actually populating the patient information in the form so that the nurse can reference it, like phone number, name, and things like that. And then we configure our actions. Now these actions are actually tied to outcomes. So you can see I've got complete, send follow-up links, and schedule follow-ups. And this automatically built all my new workflow steps for me to continue on in the process. Okay. We can define where we want the workflow box to occur, and I've said we want to put it at the bottom. And then I can also transfer form data into another process. So if I wanted to write all that data that I collect during the nurse interview to another place, I can do that as well. And I'm going to send an event notification. And in this case, once the nurse gets assigned, they're notified, and then they'll actually get a task that's emailed to them as well, and they can open the task from the email. Okay, I'll go ahead and cancel that. So these are the different steps, and then we'll go through and we'll actually send a dynamic follow-on email to the patient. And you can see that I've put the patient email in there, so it's dynamic. I'll build the subject line. And then I'm going to send the patient some links about their condition. Now I could make these links dynamic based on the condition that the patient has or information that's entered during the form. And then I put the nurse first name and last name that was assigned. Okay. So let's go ahead and look at this. If I take a peek at the workflow, I've already got some windows open. The first thing I'm going to do, our patient is Cody Kaji. So the minute that her record was created and the workflow got kicked off, she was notified. Okay, there was an email that was sent. Welcome to Denalix Health. You're now in the system. And if I wanted, I could have a link here where he or she could actually check the status of what's going on. And we'll go ahead and shrink that for now. And the other item that I've had, I've actually built a nurse portal. So in this portal, when the nurse logs in, we know the security context. We can see that it's Bob Maggio, and we can see all of Bob's tasks that are assigned. Now, Bob also got notified via email, so he could action those via email. And then Bob has an action item here, or action menu. He can open the form, send follow-on links, schedule follow-up, complete it. He can sleep the task, assign the task to somebody else, can share the task. But in this example, we're going to go ahead and open the form. And I built out this form really quickly, and you can see it's got three different views. The first view is actually going to be comprised of the patient information. So I pass the patient data from the record that was written into this window. So you can see that Bob now has that information to be referenced, and he's got the phone number, so he can actually call the patient. I built a patient notes section that is a view within the form, and then the workflow approval section. Now, each of these views is reusable. So if I built this patient information once, I can reuse it in form after form after form or project after project. So as Bob, I can come in here and say, this patient has a spine injury and issues. Okay. So when I click complete, I could actually write this to a table as well and maintain all these notes along with the patient data for future reference and reporting. Maybe you want the provider to have access to all the different calls that happen during the day. And I'm going to come down here and I'm going to say, you know what, this patient is good to go. They just want follow-on links. Click submit. And now my task is completed. So now if I come back here to my workflow or to Cody's email box and we give it a second, we're going to actually see some follow-on links that come through to Cody so that she can look at some more information. So you'll see here I've got some follow-on links from Denalix Health. The nurse initiated the follow-on links. I got my links. Now I could initiate other processes. If I take a peek, you see that I followed the workflow and sent follow-on links. I could do things, other steps. I could schedule follow-up appointments. I can do data writes. I can do all kinds of things as different outcomes. So that's just a quick overview of this workflow that I built from start to finish, along the data layer, the forms, as well as the workflow and the completion. Okay.